Hello and welcome to our endoscopy unit at Aintree University Hospital. We are located on the third floor of the Elective Care Centre. To access the department, you will need to enter on the ground floor, where you will see both the lifts and the stairs. We are a JAG accredited service, and this means that we have undergone a rigorous independent assessment. This ensures that our service delivers best practice quality standards covering all aspects of an endoscopy service, including quality and safety, patient experience and workforce. If you are watching this video, it means you have been asked to attend the endoscopy department for a specific procedure. This will be a camera test into your stomach, bowel or lungs. These are called gastroscopy, flexible sigmoidoscopy, colonoscopy, PEG or PEG-sac insertion, bronchoscopy, thoracoscopy or an ERCP procedure. You may have received a letter, text or telephone call with date and time for your appointment. You should have also been given specific patient information instructions for the preparation of your procedure. On the day of your appointment, you will need to report to the reception desk. One of our friendly reception staff will confirm your appointment and then ask you to take a seat in the waiting room. We have 8 endoscopy theatres operating 2 sessions per day, so we are a busy department and it may seem that patients are being seen out of order of arrival. Please be assured that different theatres have different procedures and the role of the team is to ensure that the operation flow of all the theatre is maintained. You should be expected to be in the department for up to 4 hours. Please feel free to ask one of the team for an update. Following your arrival, you will be called by one of the nursing staff into a consultation room. During this consultation, you'll be asked several questions about your appointment and medical history, so please ensure that you have a current list of your medications with you. We will ask you if you have completed the pre-procedure instructions and if you wish to have sedation for your procedure. The nurse will be entering this information electronically. The nurse will also check your blood pressure, pulse, oxygen levels, breathing rate and temperature. You'll be asked to explain in your own words what procedure you are attending for. The nurse will confirm this with you and will explain the risks and benefits of the procedure. At this stage, you will have the opportunity to ask any questions you may have, and then you will need to sign a consent form. If you are having a gastroscopy procedure, you'll be asked to sit in the specific area. Unfortunately, your relatives or friends will not be able to wait with you. They will be directed to the coffee shop or waiting area on the ground floor. We will contact them for you when you are ready to leave. You will not be required to change into a gown for this procedure. Please ensure that you are wearing comfortable clothing. If you are having a flexible sigmoidoscopy or colonoscopy, you will be shown to one of our changing cubicles and you will be provided with a hospital gown and a pair of shorts. You will be asked to wear the gown with the ties to the back and the shorts need to be worn with the opening to the back. You will need to keep your property with you. It can be helpful to bring a bag, however, one will be provided for you to use. Please do not bring valuables with you to your appointment as we do not have space to store these for you. You will need to ensure that you retain your footwear as you will be walking into theatre. We have a dedicated staff member who will insert a cannula for patients who wish to have sedation. A cannula is a small, thin plastic tube that is inserted into a vein, and this allows us to administer a sedative and a painkiller. The sedation is given in theatre and is very fast-acting. We use conscious sedation, and this should not be confused with general anaesthesia. Patients who choose to have conscious sedation are awake during their procedure. The sedation is to help reduce some of the anxiety you may be experiencing. It also has a slightly amnesic effect. This is a desired effect and will mean that you may not be able to recall all the details of the procedure. A painkiller is usually given along with the sedation for lengthy, complex procedures. You will need to ensure that you have made the necessary arrangements to be collected from the hospital, as we cannot give you sedation or pain relief if you do not have a named contact to collect you from the department. They will need to provide aftercare for 24 hours post-procedure while you recover at home. This is to ensure the sedation has worn off. Please be aware you will not be able to drive for 24 hours after having sedation. When it is your turn, you will be called through by one of the nursing team, who will be with you during your procedure. You will be asked to take a seat on the trolley and the team will introduce themselves to you. The nurse in the theatre will ask you questions that you will already have answered, but this process is part of our safety checks. You will be asked by the endoscopist to confirm your signature and be given a final chance to ask any questions before the team start. All of our procedures vary in the length of time it takes, and a gastroscopy, a camera test into the stomach, is one of the quickest procedures we perform, usually lasting 5 to 10 minutes. When your procedure is complete, you'll be taken through to one of the 3 single-sex recovery areas. You will be given time to recover from your procedure. You will be closely monitored, and when you are ready, the nursing team will contact your family or friends and instruct them where to collect you. If you were changed, you will be asked to get dressed, and please ensure that you collect all your belongings. Following your recovery, you'll be escorted to the discharge area. Here you'll be offered a warm drink and a light snack. One of the nurses will explain your procedure report and you'll be allowed to ask questions. The nurse will also ask you questions to ensure that you have recovered. You will be provided with an aftercare patient information leaflet, and this will be explained to you. This will detail what to look out for in the next 24 to 48 hours and how to contact us should you be concerned. If any biopsies or polyps were taken during your procedure, the results will be returned to the referrer who arranged for you to have the test in the first place, and they are responsible for communicating these results to you. There are a few things we need to share with you prior to your appointment. We are a large acute teaching hospital. Therefore, you may find that teaching is being delivered in the theatre where you are having your procedure. You will be informed of this on the day. If you do not want a trainee present, please let us know when you arrive. We have several different bowel preparation products available for you. The type of bowel preparation that you require will be decided by your referrer. Our standard bowel preparation is either Movie Prep or Plenview. You will be provided with the preparation and instructions on how to take this. Please do follow the instructions carefully. If the bowel is not cleansed correctly, your procedure may be cancelled or the bowel prep deemed to be inadequate, and this may require your procedure to be rebooked. We hope this short video has helped to answer some of your questions and reduce some of your uncertainty about your procedure. We look forward to seeing you for your appointment.